myself. Okay. Who I am, you should know. Before speaking about the subject, if you know who I am, it would be better for you. Okay. I'm a pharmacist basically. I'm not from your background nursing. I'm a pharmacist. Okay. In the health society and the health maintenance, there are 3 to 4 important persons. Number one will be the doctors, isn't it? Next person will be indispensable graduates who spend their life mostly with the patients as well as doctors or nurses, right? Yourself. And then there will be some kind of paramedical faculty members who will be very, very helpful to you. And they may be either information provider or assistance provider, in which the first and foremost category is pharmacist. In that category, I am coming under. Okay. Apart from that, physiotherapists are there, right? And so many other divisions, and a lot of things are there. But under the paramedic, we will be in the first cadre next to you in order to look after the patients, isn't it? Yeah. What is our duty and how we differ from you? Simple thing. You people will have the basic subjects of life sciences in which medical area, especially nursing, is an area which has been taken away from or which has been slightly deviated from medicine, right? Patient care will be much more dominating in your syllabus. In our syllabus, drug invention, discovery, preparation, formulation, release, marketing, supply. These work will be ours. So pharmacists, we deal with the production of drug, invention, discovery, production, formulation, quality control, marketing and supply of drugs. This is our work. Your work will be assisting the surgeon and physicians in diagnosing the disease and treatment of diseases, and then surgery and all other aspects of patients. Okay, where we too, nursing and pharmacists are merging in patient care. In our branches, a separate subject is called as a medical subject called as clinical pharmacology. Clinical pharmacology. Okay, that subject sometimes may become very common to you also, you and me also, right? Pharmacist and nursing, right? When they become merged together, we will be taking main part in taking care of the patient. When you go and observe their symptoms and their disease status, and when you concentrate on medication, we will be giving you medication information, and depending upon the side effects and other adverse reaction, how to change the drug combination, all other ways information and knowledge will be provided by us to the nursing students. Nursing, you understand? So we combine in the hospital in one care, especially clinical aspect and hospital aspect and community aspect, patient care will be the common for us, patient care. And now today, you are all exposed to the subject called as pharmacology. It is a kind of subject coming under life sciences, especially medical sciences, The MBBS students, when they touch their second or third year, they will also start studying. Probably in your second or third semester or fourth semester, you may come across this subject, pharmacology. Likewise, pharmacy students in their second and third year degree and second year diploma, they will come under a situation, they must meet the subject called as pharmacology. Pharma means, you can remember a simple word, a medicine or a drug. A medicine or a drug. What is a drug? Drug is a chemical molecule. Drug is a chemical molecule. When it is appropriately administered exogenously into a body, it will be capable of changing body function. The sense, when you have a disease, when we have a disease in our body, what is meant by disease? It is an easy definition. We can use disease is an abnormal function of our body. Abnormal function of our body. Right? It's also a disease, right? Pain alone is not a disease. If there is a disease, certain kind of symptoms like severe pain may come. Understand? Yes. Likewise, symptoms are a kind of sign expressed in our body which may be easily notable or viewable or understandable, conceivable, but a disease sometimes may not be easily viewable, it will be inside. Once when the disease comes, automatically symptom will start. You understand? So either we will select treatment, either symptomatic treatment or chemotherapeutical treatment or bodily problem, the treatment, appropriate treatment. The disease in the world can be divided into communicable and non-communicable diseases. Isn't it?
Yes.
Yeah. If we have a problem, it is a disease, I told you. If it is a chemical substance, any chemical substance which can act as a drug. See, if you place sodium chloride, normal sodium chloride on the table of your kitchen, it is namak.
Yes.
Sodium chloride, that's sodium chloride. When 0.9 gram of sodium chloride is added into 100 ml of water and is converted into 0.9% solution, volume by volume solution, weight by volume solution, it will be called as a saline solution. A saline solution, which is capable of balancing osmotic pressure and liquid content in our body, hydration content in our body. Such a fantastic substitute. The same sodium chloride, when you add in hot water a little bit, in hypo or hyper level, hypo level, and gargled, it's a very good local antiseptic. It's a very good local antiseptic. So the view, how you are putting forth on a chemical substance will be giving you a conceivable or understandable, a firm definition of what it is. You can call copper as a metal. When the copper is taken inside, it will create some kind of action in the body. And sometimes it may be therapeutical or non-therapeutical or side effect, it may create some kind of adverse effect. So any chemical substance, when it is engulfed, except protein, carbohydrate, fat, which are all food, except food material, any kind of chemical, when it is taken exogenously, it will be capable of creating some kind of changes in the body function. So a change in the body function is a disease, so that a disease can be cured by providing drug, a chemical substance. You understand? Clear? So, what is that hypo and hyper function in our body? As I told, disease may be of two different categories. One is non-communicable, other one is communicable. When the disease is spreading from one person to other person, it is called as communicable. It may be caused by microorganisms. Isn't it? The microorganism is a separate world. It may be starting from fungi, algae, right? Mainly fungi, pathogenic in nature. Some fungi, not all fungi, right? Some fungi are pathogenic in nature. Pathogenic in the sense of disease creating in nature. Likewise, virus, bacteria, right? So these microbes, when invaded into your body, it may create disease. Again, you may ask a question. Why, sir, when the microorganism is already available in our body, right? Our nasal tract, gastrointestinal tract, ears, everything is having microorganism. Even our oral cavity, teeth, everything is having microorganism. When it goes, it creates disease. How, sir? It is called as invasion of foreign body. If something is already available in our body by birth, or when we acquire something by nature, it will be tolerated. But something is new, which is not tolerated by your body, is entering into our body, it will have antigenic character. Antigenic character in the sense that it will act as a foreign body, which will be defended by our body immune mechanism. Our body immune mechanism will start kicking and will act against that particular antigen. So that the antigen-antibody reaction and further reaction will occur. You understand? Neutralization of antigen. That antigen may be either it may be a virus or bacteria or pyrogen, create fever-creating pyrogen or anything it may be. So when something is either through oral route or through skin or through any other route, when it is entering into our body and is not accepted by body, it will be neutralized. It will be neutralized by our body. When the immune function is normal, it will be capable of acting against the microbe. It's okay. When our immune function is hypo, and someone or somebody their body makeup, natural makeup or genetic makeup, is not providing the immunity function up to the level of acting against a virus. What we have to do is only one choice. Either we have to go for vaccination or we have to go for antiviral drug. To kill the virus, whether we have to choose vaccination and thereby creating immunity, inducing immunity in our body, or antiviral drug. So you have to study about antiviral drug. How to provide treatment to a patient with the help of appropriate chemical substances as drug, as antiviral drug. You understand? So, including cancer, several drugs are useful to treat microbial infection of our body. Such treatments are called as chemotherapy. Chemotherapy. Chemo means chemical, therapy means treatment. So, providing chemical substances for the treatment of microbes. When cancer comes, it will act as a microbe like more or less, abnormal bodily cell production. Likewise, as a microbe enters in our body, it will utilize the mechanism of our body and it will also start growing. The same way cancer also grows. So we are targeting cancer cell microbe in the same way so that both the drug classification come under chemotherapeutic agent. Cancer drug also are coming under chemotherapeutical agent, antimicrobial agent. You understand? Antimicrobial, if it is acting against bacteria, antibacterial drug. If it is acting against virus, antiviral drug. Likewise, a lot of classification. This year you will be studying that one. Apart from that, you are having some unit in kidneys, kidney function, drugs acting on kidney, diuretics, antidiuretics, drugs acting on endocrine system. Okay, in the individual endocrine gland, what are the drugs are having influences? Likewise, gastrointestinal tract. So starting from mouth up to anus, we have a long tract, respiratory, there is our digestive tract. That one is called as gastrointestinal tract, where what are the disease comes, how to treat it. Likewise, you are having one more unit, right? That is our kidneys, gastrointestinal tract, endocrine glands, general pharmacological part. General pharmacology, you are having one more, and respiratory tract. Drugs acting on respiratory. If you take your syllabus, first general pharmacology. First, what is pharmacology? You have to learn. What are the different areas of pharmacology? What are the relevant subject of pharmacology? What are the sources of drugs? And what are the terminology of pharmacology? Right? After studying this general pharmacology, you will go to the individual system where we will start with the normal endocrine system, drugs acting on endocrine system, drugs acting on that is the lungs and respiratory tract, drugs acting on stomach and intestine and gastrointestinal tract, drugs acting on kidneys. You understand? Urinary tract, all will be your syllabus. Apart from that, one unit is chemotherapy. So this year you are going to start with the general pharmacology. Your from next class will start with the general pharmacology. General pharmacology in the sense is pharmacological principles. Without that, when you enter into pharmacology subject, you may not be able to understand. Number one. Number two, the basic subject for pharmacology is anatomy, physiology. Anatomy, physiology. If you are very sound in anatomy and physiology, your pharmacology will be very, very easy. Because you are going to manipulate the system with the drug. That is nothing but pharmacology. So when you engulf a drug, there are two effects. Body does to the drug something, drug does to the body something. When the chemical substance is administered, it may manipulate our function or our body may manipulate the drug. When our body manipulates the drug will be taken into the body, absorption, drug may be traveling in the body, distribution, drug may be metabolized in the body by liver, metabolism, and it may be eliminated from the body, excretion and elimination. Metabolism and excretion both combined, we will call it as elimination. You understand? Elimination in the sense out of body. When something goes out of body, it should be metabolized. Metabolism and excretion combined, elimination, absorption, where from you are applying drug, from there, how it is taken into bloodstream or local area, that is called as absorption. Then how it is traveling in the body is distribution. So absorption, distribution, metabolism, excretion. So this is what our body does to the drug. You understand? What the drug will do to the body. What the drug will do to the body. Drug will do something in the body. That is treatment of disease, isn't it? So drug will act in the body. Drug will express its kinetics in the body. the drug molecule will go and manipulate the body function. Either it may do something hypo or hyper. So something is happening in the body by the administration of drug. When a drug is introduced into the human body or a living body, it is capable of being absorbed and distributed, metabolized. When the metabolism occurring, it will be capable of reaching other system wherever necessary, wherever the binding receptors are exact place where the drug can bind, it will bind and it will express its action. That expressing action is called as pharmacodynamics. Pharmacodynamics. So, pharmacodynamics means what the drug is doing to our body. Pharmacokinetics means what the body is doing to the drug. So, when the drug is administered into our body, first it will be absorbed, it will be distributed, then metabolized and excreted. That is what the body does to the drug. What your body is doing to the drug. What the drug is doing, it's doing its action. That is called pharmacodynamic. Dynamic means action. A person is dynamics in the sense it is not like that. A person is dynamics in the sense he is very, very active. You understand? So the drug molecule is capable of expressing its action. Expressing its action. Some drugs are before metabolism active, some drugs are after metabolism active. That will come under pro-drug. Your sir will talk. You understand? So today I am giving only the basic aspect of pharmacology. Okay, individual topic your sir will talk. In this anything difficulty you may convey to sir, I will come and deal with that. Okay, I am not a pharmacologist, I am a pharmacognosist. My area is natural source of medicines. You understand? But I am an all-rounder in pharmacy, can teach any subject. I am utilizing that opportunity to give something to you, to share something today with you. So now you people, nursing people are very, very clear of 4 or 5 terms. Number one is what is a drug? Drug is a chemical substance. When it is administered into our body, it is capable of manipulating body function. Clear now? Everybody? What is a disease? Any abnormal body function can also be called as a disease or a disease status. You understand? Right. So the disease can be cured by drug. Disease can be cured by drug. If it is a living body, it is possible. If it is a dead body, body will not respond. No absorption, no distribution, no metabolism, no excretion. So drug cannot act. Wherever you are given, it will be there only. You understand? Well, so the treatment or any kind of action, drug has to act in the body should be alive, body organs should be alive, the body organs and body should be capable of responding to a chemical agent which is exogenously administered through our systems. You understand? So we have several systems in the body. Every system has many number of organs. Every organ has multiple tissues. Every tissue has a particular action. So targeting the tissue, targeting the organs. Targeting the tissue, targeting the organs. Where a particular type of action can be achieved. For example, furosemide, a drug available in the market. Furosemide. It's a very good diuretics. Okay? The diuretics may be of 2 types. Diuretics means may be of 2 types. Physiological diuretic, pharmacological diuretics. When you take plenty of water, more than 1.5 liters per day, urination will be increased. Increased urine output is called as diuretic effect. So normal water, if you drink 3 liters, 4 liters, 5 liters, urination will take place. That is called as diuretic action, physiological diuresis. That is not going to create any problem in the body. But pharmacological diuresis, suppose if a person is having leg swelled or a particular organ swelled, full of water and kidney is not functioning properly, during the time we will select furosemide like diuretics. When it is given, it will increase kidney function, it will increase filtration rate, it will increase the output of urine. Though you are not taking much water, urination will be increased. That is called as a pharmacological diuresis. Pharmacological diuresis. So now you can understand physiological, pharmacological. When a normal body function, if you manipulate by normal food and water, it is normal physiological effect. It is not going to create any disease. But in your body, there is already a problem. The problem is created, which is unwanted problem, which is not in your normal body. It cannot be accommodated in the body, but if the problem created, that problem is solved, it is called as pharmacological aspect. So, chemical substance now mixed with our body to treat the disease. You understand? So physiology, anatomy is the basic subject. When it is, the manipulation is done by a chemical substance, the subject is becoming pharmacology. Clear now? How a drug is going to respond, how your body is going to respond to the drug is pharmacology. Clear now? So pharma means drug, logo means study, discourse, details, knowledge. So pharma, drug knowledge is pharmacology. Pharmacology. It has connection with many subjects. What are the different connected subjects is another question. Biochemistry, anatomy, physiology, biochemistry, clinical aspect of pharmacology, therapeutics, okay, medicinal chemistry, pharmaceutical, medicinal chemistry, pharmacognosy, right, botany, zoology. These are all highly connected with the pharmacology, highly connected with the pathology, health education. These are all the connected subjects of pharmacology. Enough, sir. Thank you. Just for a YouTube photograph, right? YouTube video. Enough, sir. Okay, cut it, sir.